I think that we're an excellent community oncology hospital, is what would be described as in America, with an academic link. We're a teaching hospital of University College, Cork. Con and I are senior lecturers. Our medical students have presented papers across Europe and America. So I think that there's a very good standard of community oncology.
I deal with what we call the systemic therapy of cancer. So we deal traditionally with chemotherapy, which is usually intravenous, but can be oral treatment that interferes with the division of cells.
We treat a lot of our patients as day cases. Because the anti-nausea drugs are so good, we very rarely have to admit people to deal with nausea anymore. And a lot of our patients live relatively normal lives and come in once a month, once every 3 months even, for drip chemotherapy or smart drugs, targeted therapy, as a day case.
I suppose the first part of the job is the clinical focus, so it's dealing with patients, and the main part of our role would be dealing with patients between chemotherapy treatments, meeting new patients when a decision has been made that they're for chemotherapy and giving their education about their chemotherapy, and then following them through their cancer journey really here at the Secours.
But increasingly, oncology is dealing more and more with other forms of systemic therapy, such as targeted therapies. And these are treatments that exploit a particular molecular weakness within the cell in order to achieve disease control or cure.
So when I was in the States, I worked on phase 1 trials, which is the first time that humans see drug. And now in the Secours, in the last 5 years, we've gone from having a half-time research nurse to having 1.5 research nurses. And we're running over 10 trials at the moment. And there are some molecules that we're the only site in Munster or the only site in Ireland with the drug.
So most of our trials here are what's called a phase 2 or phase 3 clinical trial. So there's already been research done to prove the safe dose of the treatment to give patients, and they would already know the side effects or the potential side effects caused by the drug.
The treatments have got better. We have got better at recognising what treatments patients should be on, and we have got better at recognising side effects and managing them.
We've got a certified compounding pharmacy, so most of our chemo will be made on site and a small amount of it we buy in.
I have a clinical responsibility in verifying all of the chemotherapy prescriptions that the patients that we receive on a daily basis, and I also have my second role is that we supervise the manufacturing of chemotherapy here in the hospital as well. A lot of the newer drugs have very short shelf lives once they're made up. So we have one drug that has 45 minutes from the time you reconstitute the powder to it being given to the patient. So we really wouldn't be able to offer that service or that drug to the patient if we didn't have an on-site manufacturing facility.
We've got daily communication with our pharmacists, and we learn from them and they learn from us, and we work together to make sure right drug, right patient on time.
It's a great place to work with. I would say there's a dynamic team. The 2 consultants are great. They're young, they're forward-thinking, they're research-minded, and I think the patients are very lucky to have those 2.
When I came here, I was very impressed by how organised and clean the Bonds was, and how good the food is, and still is. And it makes a difference for patients when they can know that the food is edible and the ward is clean. And hopefully we're still as organised and as efficient as we were when I came to the Bonds 5 years ago.
I think we have some of the best oncologists in the world in Ireland. I think we can be very proud of what we do and the level of quality cancer care that we deliver. And we're particularly proud of what we do here, obviously, in the Secours. But one of the great things about working in this hospital is that there's huge crosstalk between the specialties, and it's very easy and practical to get other specialties involved with the care of our patients.